Question 1. When searching the ICD-10 CM Alphabetic Index, what term should you initially look for to locate the correct code? A. An anatomical site. B. A sign or symptom. C. A diagnosis or condition, main term. D. A body system. Answer: C. A diagnosis or condition, main term. This question tests your understanding of the crucial first step in ICD-10 CM coding, which is locating the main term in the alphabetic index. The main term is typically the disease, condition, or injury, not just a symptom or body part. Finding the correct main term directs you to the appropriate code range in the tabular list, where you'll confirm the final code based on additional details. Always start by identifying the patient's diagnosis or reason for the visit as your main term in the index. This systematic approach helps ensure you land on the correct code category right from the start. Question 2. A patient is diagnosed with a fracture of the shaft of the right tibia due to a fall from a ladder at work. What type of additional code is necessary to describe the circumstances of the injury? A. AZ code. B. A procedure code. C. An external cause code. D. A sign and symptom code. Answer: C. An external cause code. This question focuses on coding injuries and their causes, specifically the need for external cause codes. External cause codes provide crucial information about how an injury occurred, the intent, e.g., accidental, intentional, and the location. While the fracture code describes the injury itself, an external cause code explains why and how it happened, like a fall from a ladder at work. Reporting external cause codes gives a more complete picture for injury research and prevention efforts. Question 3. According to ICD-10 CM guidelines, how should you code a diagnosis documented as probable, suspected, likely, or possible in an outpatient setting? A. Code the condition as if it exists. B. Do not code the condition. C. Code the signs or symptoms instead. D. Code AZ code for uncertain diagnosis. Answer: C. Code the signs or symptoms instead. This question highlights an important outpatient coding guideline regarding uncertain diagnoses. In the outpatient setting, unlike the inpatient setting, you should not code a diagnosis documented as uncertain or probable. Instead, you should code the documented signs, symptoms, or abnormal test results that led the provider to suspect the condition. This guideline ensures that outpatient coding reflects only confirmed diagnoses or active issues being treated. Question 4. Which character in an ICD-10 CM code often indicates laterality, left, right, or bilateral? A. The first character. B. The second character. C. The fourth character. D. The fifth or sixth character. Answer: D. The fifth or sixth character. This question tests your knowledge of ICD-10 CM code structure, specifically where laterality is typically found. While not every code specifies laterality, when it does, the fifth or sixth character is commonly used to indicate if the condition is on the left side, the right side, or is bilateral. Paying close attention to these character positions is essential for accurately capturing whether a condition affects one side or both. For example, many musculoskeletal and I codes use these characters to specify laterality. Question 5. A patient is admitted to the hospital with pneumonia. The provider notes the patient also has a history of resolved pneumonia from 5 years ago. How should the history of resolved pneumonia be coded? A. Code current pneumonia only. B. Code current pneumonia and active history of pneumonia. C. Code AZ code for history of pneumonia. D. Code the resolved pneumonia using an old code. Answer: C. Code AZ code for history of pneumonia. This question focuses on using history codes in ICD-10 CM. A personal history code, AZ code, is used to indicate a past medical condition that no longer exists and is not receiving any treatment, but which has the potential for recurrence or is important for follow-up. Since the past pneumonia is resolved and not currently active, AZ code is appropriate to document this relevant past health information. Coding the current pneumonia is necessary, but the history requires a separate code. Question 6. In ICD-10 CM, what does a placeholder character, represented by the letter X, signify? A. An invalid code. B. A code requiring more characters. C. A code for external causes only. D. A code requiring a 7th character extension. Answer: D. A code requiring a 7th character extension. This question is about the use of the placeholder X in ICD-10 CM coding. The X is specifically used as a placeholder when a code requires a 7th character extension but does not have 6 characters before it. This ensures that the 7th character is placed in the correct position to provide necessary additional information, often related to the encounter type, initial, subsequent, sequelae. The X fills the empty character spots to maintain the correct code structure. Question 7. A patient receives routine immunizations. What type of code would be used to report this encounter in ICD-10 CM? A. A procedure code. B. An external cause code. C. AZ code. D. A sign and symptom code. Answer: C. AZ code. This question tests your understanding of Z codes, specifically those used for encounters related to health services for reasons other than illness or injury. Z codes are used for a variety of purposes, including encounters for prophylactic measures like immunizations. Routine immunizations are preventive healthcare services, not treatment for a current illness, making AZ code the correct choice to describe the reason for the visit. Question 8. A patient has a diagnosis of acute bronchitis with chronic obstructive pulmonary disease. According to coding guidelines, how should this be coded? A. Code acute bronchitis only. B. Code chronic obstructive pulmonary disease only. C. Code both acute bronchitis and chronic obstructive pulmonary disease. D. Code a combination code if available, otherwise code both separately. Answer: D. Code a combination code if available, otherwise code both separately. This question addresses coding conditions that often occur together and the potential for combination codes. When a patient has both an acute condition and a chronic condition, and the acute condition is an exacerbation of or associated with the chronic condition, you should look for a combination code first. If a combination code exists that captures both diagnoses with their relationship, use that code, otherwise, code both conditions separately. This reflects the relationship between the acute exacerbation and the underlying chronic disease. Question 9. What is the purpose of the tabular list in ICD-10 CM? A. To alphabetically list all valid codes. B. To provide the definitive code with instructional notes. C. To list external causes of morbidity. D. To provide definitions of medical terms. Answer: B. To provide the definitive code with instructional notes. This question asks about the function of the tabular list, which is where you finalize your ICD-10 CM code. After locating a potential code range in the alphabetic index, you must always refer to the tabular list to verify the code and review any important instructional notes, such as includes/excludes notes, code first, use additional code, and character requirements. The tabular list contains the codes organized by body system or condition and provides the necessary details to select the most specific and accurate code. Question 10. A patient presents with abdominal pain. After evaluation, the diagnosis is confirmed as appendicitis. How should the abdominal pain be coded? A. Code both abdominal pain and appendicitis. B. Code abdominal pain first, then appendicitis. C. Code appendicitis only. D. Do not code abdominal pain unless it persists after treatment. Answer: C. Code appendicitis only. This question addresses coding signs and symptoms when a definitive diagnosis has been established. When a sign or symptom, like abdominal pain, is a characteristic symptom of a diagnosed condition, like appendicitis, you should code only the definitive diagnosis. The pain is considered integral to the appendicitis. You would only code the symptom separately if the provider documented it as unrelated to the confirmed diagnosis or if no definitive diagnosis was made. Question 11. Which of the following is a convention used in the ICD-10 CM tabular list to indicate that another code must be used with this code to fully describe the condition? A. Excludes 1. B. Excludes 2. C. Code first. D. Use additional code. Answer: D. Use additional code. This question tests your knowledge of instructional notes in the tabular list, specifically those indicating required secondary codes. The use additional code note signifies that the code where this note appears is often a manifestation of an underlying condition, and therefore, a code for the underlying condition must be coded first. It tells you that you need to report 2 codes to fully capture the patient's condition and its cause or manifestation. Question 12. A patient is admitted due to a complication of a surgical procedure performed during the current encounter. According to ICD-10 CM guidelines, how should the principal diagnosis be determined in this scenario? A. The reason for the surgery. B. The complication. C. Both the reason for surgery and the complication. D. A code for complication of surgery. Answer: B. The complication. This question focuses on inpatient coding guidelines for complications occurring during the same hospital stay as the procedure. If a complication arises during the hospitalization and the patient is admitted due to that complication, the complication is typically designated as the principal diagnosis. The complication is what primarily occasioned the admission, even though it stemmed from a procedure performed during that stay. Question 13. When coding a chronic condition that has multiple sites, such as osteoarthritis affecting bilateral knees, how should this be coded if there are separate codes for left and right? A. Use a single code for osteoarthritis. B. Code the code for osteoarthritis of the right knee only. C. Code the code for osteoarthritis of the left knee only. D. Code both the code for osteoarthritis of the left knee and the code for osteoarthritis of the right knee. Answer: D. Code both the code for osteoarthritis of the left knee and the code for osteoarthritis of the right knee. This question addresses coding bilateral conditions when specific codes exist for each side. If ICD-10 CM provides separate codes for the left and right side of a bilateral condition, and the patient has the condition in both locations, you should assign both the code for the left side and the code for the right side. Do not use a code for an unspecified side if both are known and specific codes exist. Question 14. In ICD-10 CM, what does the term sequelae refer to? A. The initial injury or illness. B. An additional condition that develops as a result of a previous illness or injury. C. A recurring condition. D. An acute exacerbation of a chronic condition. Answer: B. An additional condition that develops as a result of a previous illness or injury. This question defines a key term in ICD-10 CM coding: sequelae. A sequelae is a condition that is the late effect of a previous injury or illness. It's a residual effect that occurs after the acute phase of the original condition has passed. When coding a sequelae, you typically need 2 codes, one for the condition constituting the sequelae and one for the original injury or condition that caused it. Question 15. A patient is being seen for a routine follow-up visit after completing treatment for a malignant neoplasm of the colon 6 months ago. There is no sign of recurrence. What type of code should be used for the encounter? A. A code for the malignant neoplasm. B. A Z code indicating history of malignant neoplasm. C. A code for follow-up examination. D. A code for screening. Answer: B. A Z code indicating history of malignant neoplasm. This question involves coding follow-up care after cancer treatment. When a patient has completed treatment for a malignant neoplasm and is seen for follow-up surveillance with no evidence of recurrence, a Z code for personal history of malignant neoplasm is used. This indicates that the patient no longer has the active malignancy but is being monitored due to their past diagnosis. The follow-up code may also be used depending on the specific reason for the visit. Question 16. When coding a condition, you find a note in the tabular list that says excludes 1. What does this note signify? A. The condition excluded is included in the code above. B. The two conditions listed are mutually exclusive and cannot be coded together. C. The code should be used only for the first encounter. D. The code requires a 7th character. Answer: B. The two conditions listed are mutually exclusive and cannot be coded together. This question explains the meaning of the excludes 1 instructional note. An excludes 1 note indicates that the condition listed after it is entirely separate from the condition represented by the code and should never be coded with it. The two conditions are mutually exclusive, meaning a patient cannot have both at the same time. They require different codes. Question 17. A patient is diagnosed with uncontrolled type 2 diabetes mellitus with diabetic neuropathy. How should these conditions be coded? A. Code type 2 diabetes only. B. Code diabetic neuropathy only. C. Code type 2 diabetes and diabetic neuropathy separately. D. Use a combination code for type 2 diabetes with neuropathy, and an additional code for uncontrolled status if available. Answer: D. Use a combination code for type 2 diabetes with neuropathy, and an additional code for uncontrolled status if available. This question demonstrates coding diabetes with complications. ICD-10 CM provides combination codes for diabetes mellitus with certain associated conditions like neuropathy. When a combination code exists that fully describes both the diabetes and its complication, that code should be used. If the diabetes status, e.g., uncontrolled, requires an additional code according to the tabular list instructions, that should also be assigned. Question 18. What is the primary reason for using the alphabetic index before the tabular list when coding in ICD-10 CM? A. The alphabetic index provides more specific codes. B. The alphabetic index organizes codes numerically. C. The alphabetic index helps locate the correct code category or range. D. The tabular list contains only supplementary information. Answer: C. The alphabetic index helps locate the correct code category or range. This question reinforces the correct workflow for ICD-10 CM coding. You always start with the alphabetic index to look up the main term, the diagnosis or condition. The index provides a list of potential codes or code ranges associated with that term. You then use this information to navigate to the tabular list, where you verify the code, check for instructional notes, and select the most specific code based on the documentation. Question 19. When coding an acute condition that has a specific code for acute and a code for the chronic form, and the provider documents the condition as acute, which code should be used? A. The code for the chronic form. B. A combination code for acute and chronic. C. The code for the acute form. D. A code for unspecified if no combination code exists. Answer: C. The code for the acute form. This question addresses coding acute versus chronic conditions. If the documentation specifies that the condition is acute, and there is a distinct code for the acute form in the tabular list, you should assign the code for the acute condition. Do not assume it is chronic unless the documentation states so. Coding accurately relies directly on the provider's documentation of the condition's acuity. Question 20. A patient is admitted for chemotherapy for a primary malignant neoplasm of the lung. What is the principal diagnosis? A. The chemotherapy. B. The malignant neoplasm of the lung. C. AZ code for chemotherapy encounter. D. Both the neoplasm and the chemotherapy. Answer: B. The malignant neoplasm of the lung. This question pertains to coding encounters for cancer treatment. When a patient is admitted solely for the administration of chemotherapy, immunotherapy, or radiation therapy for a malignant neoplasm, the principal diagnosis is the malignancy itself. A Z code for the encounter for antineoplastic therapy is then used as a secondary diagnosis to indicate the reason for the encounter. Question 21. What does a note in the tabular list that says excludes 2 indicate? A. The excluded condition is part of the condition represented by the code. B. The condition excluded is never coded with this code. C. The condition excluded is not included here but is not mutually exclusive and can be coded separately if documented. D. This code is for secondary diagnoses only. Answer: C. The condition excluded is not included here but is not mutually exclusive and can be coded separately if documented. This question explains the meaning of the excludes 2 instructional note. An excludes 2 note signifies that the condition listed after it is not included in the code where the note appears, but a patient could potentially have both conditions at the same time. If the medical record documents both the condition represented by the code and the excluded condition, you would code both separately. Question 22. A patient sustained a non-displaced fracture of the left radius due to a fall while playing soccer. What is the 7th character typically used for the initial encounter for active treatment of this fracture? A. B. D. C. S. D. P. Answer: A. This question tests your understanding of 7th character extensions, particularly for fractures. For fractures, the 7th character indicates the encounter type. A is used for the initial encounter for active treatment, which is typically the first time the patient is seen for the injury and receives surgical treatment, emergency care, or evaluation and management. The encounter where the patient is first treated for the fracture is the initial encounter. Question 23. When coding a pain diagnosis, such as chronic low back pain, you must also consider using an additional code for what, according to coding guidelines? A. The specific site of the pain, if known. B. The underlying cause of the pain, if known. C. The severity of the pain. D. The duration of the pain. Answer: B. The underlying cause of the pain, if known. This question focuses on coding pain, specifically the guideline to code the underlying cause when possible. While you code the pain itself, if the provider documents the underlying condition causing the pain, e.g., herniated disc causing low back pain, you should also code that underlying condition. This provides a more complete picture of the patient's condition than coding the pain alone. Question 24. What is the primary purpose of Z codes in ICD-10 CM? A. To classify external causes of injury. B. To report procedures performed. C. To classify factors influencing health status and contact with health services. D. To classify diseases and injuries. Answer C. To classify factors influencing health status and contact with health services. This question asks about the main function of Z-codes. Z-codes are a specific chapter in ICD-10 CM used to report encounters for circumstances other than a disease or injury, or to provide additional information about a patient's health status. They cover a wide range of scenarios, such as vaccinations, screenings, follow-up visits, and reporting factors like socioeconomic circumstances or personal history. Question 25. In the ICD-10 CM Alphabetic Index, what do terms indented below a main term represent? A. Alternative main terms. B. Subterms that modify the main term. C. Excluded conditions. D. Required instructional notes. Answer B. Subterms that modify the main term. This question describes the hierarchical structure of the alphabetic index. Terms indented below a main term are subterms that further specify or modify the main condition. They provide additional details about the condition, such as its location, type, or clinical presentation, helping you navigate to the correct, more specific code in the tabular list. Always look for and consider relevant subterms after finding your main term.